Hello, I am Janelle Simmons, Manager of Programs at Sigma Xi, the Scientific Research Honor Society, and we are so happy that you are here for our next installment of our distinguished lectureships on COVID-19. And we could not have done this lectureship without the support of the Committee on Lectureships, which is chaired by Dr. Mark Imhoff, and also some of our committee members, and Jamie Vernon, our Executive Director, and Iman Ghanem, Director of Programs. So at this time, I would like to introduce you all. Of course, many of you know Dr. Kiki Sanford, who has been our moderator, and she will introduce today's guest. So, Kiki, it's all yours.
Thank you, Janelle, and thank you, Sigma Xi, for inviting me once again to moderate today. I have absolutely enjoyed being a part of this series on COVID-19. Today, we have a conversation with Dr. Peter Hotez, and he is going to be speaking to us on the topic of preventing the next pandemic, vaccine diplomacy in a time of anti-science. Dr. Hotez is Dean of the National School of Tropical Medicine and Professor of Pediatrics and Molecular Virology and Microbiology at Baylor College of Medicine, where he is also the director of the Texas Children's Center for Vaccine Development and Texas Children's Hospital Endowed Chair of Tropical Pediatrics. He's also university professor at Baylor University, fellow in disease and poverty at the James A. Baker III Institute for Public Policy, senior fellow at the Scowcroft Institute of International Affairs at Texas A&M, faculty fellow with the Hagler Institute for Advanced Studies at Texas A&M University, and health policy scholar in the Baylor Center for Medical Ethics and Health Policy. He's been very visible in the media over the last 10 months talking about COVID-19, and we are absolutely honored to have Dr. Peter Hotez with us today. Welcome. Thank you so much for joining us.
Well, thank you so much for having me. It's always an honor to be linked with Sigma Xi, and I deeply appreciate all the great work that you're doing, and especially in the area of science communication, which we're learning now this year more than ever is so absolutely vital because so many of the problems that we're having right now, including this steep acceleration of COVID-19, is actually due to people believing in the anti-science disinformation. And this has become almost as big a threat as the actual SARS coronavirus type 2. And I think we've got to really, maybe today we can explore some ways that we can start counteracting that. You know, there are a number of ways to go with this today. I originally had a PowerPoint presentation shown, and we could still do that, but these days, I don't hear many people saying, I want more PowerPoint presentations. So maybe just have a conversation for about 15, 20 minutes, and then about what I think are some of the really important points. And then we can do a pretty extensive Q&A. I think more lately, as this epidemic progresses and people are more and more at home on Zoom and Skype, they're finding that more meaningful. So let's try to do it.
That sounds wonderful. And if people have questions, they can ask them in the Q&A feature of the Zoom interface.
Yeah, I'll give you a sort of an overview of where I think we're heading, and then we can go from there. So first of all, I think it's no secret that we're in a terrible situation right now in the United States, especially in the middle part of the country and in West Texas, where the virus is accelerating beyond anyone's imagination just a few months ago. I mean, I remember wringing my hands because we were going to get to Dr. Fauci's apocalyptic prediction of 100,000 new cases per day. And unfortunately, that's now starting to seem like a bargain. We're at 187,000 new cases per day. And of course, those are all underestimates. These are confirmed cases. The real number is probably 3 to 5 times higher. And we'll get to 200,000 new cases per day. And then the problem is this: we're getting these big surges on our intensive care units. And that is always the most worrisome part, especially up in North Dakota, South Dakota, where the numbers right now indicate that the highest rate of COVID-19 transmission in the world right now is in North and South Dakota. Of incredible as that sounds, that is the epicenter of our pandemic. And it's almost as bad in West Texas. In fact, if you look at it, that's the single worst large metropolitan area is probably El Paso, Texas right now. And so it's worthwhile talking a little bit about how we got here and how we're going to work our way around it. And this gets us to the title of the lecture. It has to do with a new book that I have coming out next month, which is called Preventing the Next Pandemic, Vaccine Diplomacy in an Age of Anti-Science. And it basically makes the case, and it ends with COVID-19, but it makes the case that even before COVID-19, things were starting to unravel. And so that in some ways, what's happening with COVID-19 represents a culminating event of what's been going on in the last 5 years, rather than something completely different. So, starting in the 2000s, we made great strides in global public health through the creation of the Gavi Alliance, the Global Alliance for Vaccines and Immunization, and expanding our ability to vaccinate children and putting individuals on treatments for malaria and neglected tropical diseases. And from 2000 to 2015, I think we made uninterrupted progress and saw a dramatic decline, not only in disease progress, but poverty reduction. And I think the two are related. So we went from this concept of the bottom billion, meaning 1 billion people in the world who lived on no money or below the World Bank poverty figure, down to 650 million people at that level. So not quite a reduction by half, but a significant reduction. And the two are related, because one of the things that we've learned over the last couple of decades is that these diseases not only occur in the setting of poverty, but they cause poverty because of their long-term debilitating effects on worker productivity and child growth and development, and the health of girls and women and pregnancy outcome. So we were starting to get kind of celebratory around 2015, kind of all high-fiving ourselves and on our successes. And then, as John Lennon says, life is what happens when you're making other plans, and life happened. And the life was, we saw this rise in catastrophic conflicts on the Arabian Peninsula, not only with the ISIS occupation in Syria and Iraq, but in Yemen and Boko Haram in Africa. And that actually led to collapse in health systems. So we stopped vaccinating individuals there. We saw cholera epidemics, and then not only just outright warfare, we saw a lot of political instability and socioeconomic instability in places like Venezuela, which had been leading the world in disease control. And then starting with Chavez and the Maduro regime, everything kind of fell apart. We saw the resurgence of measles there, and measles was carried back and forth across the border between Colombia and Venezuela and Brazil, as well as in Colombia. We saw decimation of indigenous people there. And then there was climate change. And one of the things that we found about climate change, it wasn't just climate change in isolation, it was climate change acting in concert with these other forces that work together in interesting ways. So for instance, on the Arabian Peninsula, when you had 50 degrees Celsius and drying up ancient agricultural lands and long periods of drought, that may have actually helped destabilize further what was going on in the Arabian Peninsula. So I think one of the points is there's a lot of interest in the role of climate change and disease, but I find it's not climate change in isolation, it's working hand in hand with those forces. And then we started to see this very aggressive rise in a globalizing anti-science movement. And that really started taking off here in Texas and Oklahoma in 2015, linked to this health freedom movement. And around the time of the Trump presidential election, claiming that, government can't tell us what to do with our kids. And we started seeing lots of kids being denied access to their vaccinations. And lo and behold, we started to see measles outbreaks in the United States. So by 2019, measles was back in America almost 20 years after it had been eliminated. And then, and we'll talk about it more with COVID-19, um, this whole anti-vaccine started not only becoming an anti-vaccine movement around Texas, but it nationalized with dedicated anti-vaccine groups like Children's Health Defense, run by Robert F. Kennedy Jr., who also started attacking scientists. He publicly labeled me the OG villain, which I had to look it up what OG stands for. So it's the original gangster villain. So you're featuring the original gangster villain here today. But then in 2020 with COVID-19, we started to see they expanded their remit to not only a campaign against vaccines, but also masks and social distancing. And this became a full-on anti-science movement. And it took on a lot of complexity as we saw the Russians heavily filling our internet with anti-science, anti-vaccine messages. And there's even been a new term coined for it called weaponized health communication around this. So you have now, and then over the summer, Robert F. Kennedy Jr. was a featured speaker in Berlin, Germany, where the CBS News reports that it was sponsored by QAnon and neo-Nazi groups, and there was an attempt to storm the Reichstag, the German parliament. And so we now have this full-on, what was an anti-vaccine health freedom movement out of Texas was a full-on anti-vaccine empire that's dominating our internet. And COVID emerged out of that, right? So COVID did not emerge in isolation. It had a lot of help from all of these social and determinants and climate change. And I think one of the important parts of the book are, individuals who are getting their doctoral degree in physical sciences or biological sciences. Most are not hearing about war, climate change, political collapse, anti-science, and all of these things. And maybe it's a wake-up call that we have to start broadening our education. I think also the message is around science communication, which, Kiki, I know you've dedicated your life to. I think these anti-vaccine and anti-science groups flourished in part because there was a vacuum that we did not have, or we do not have a cadre and the sufficient number of doctoral level trained scientists who are out there engaging the public, speaking to the public, who are good at science communication. Too often it's dumbed down to the 4th or 6th grade level to the point where it's unintelligible, or it goes the other extreme in too much jargon. And I think this is another really important, message. Sorry, I was just talking on CNN. It's just been talking nonstop. It's just been nuts. That we need to train scientists to be better communicators and to have a greater visibility. And most of the young scientists love it. It's the problem is the scientists of my generation. When I was trained, I got my medical degree and PhD in New York at Rockefeller and Cornell. And the message there was, you don't engage the public. You don't talk to journalists. That was seen as a form of self-promotion or grandstanding. And all of those ideas, I think, were framed before something called the internet came along and before social media came along, certainly. And now I think we've got to fix this. We have to get our doctoral level trained scientists better than ever in terms of public communication. And that's going to take a big culture change in our profession. So now we have COVID-19 here, and it's accelerating at these unprecedented levels right now in the United States. And a lot of it is happening because people are deliberately defiant of public health messaging. And it's not happening by accident. It's all of those same anti-science forces and the Russians and everything else. But on top of it, you have a deliberate disinformation campaign that came out of the White House and ultimately headed by Scott Atlas that claimed that COVID-19 was a hoax, or that the deaths were not really due to COVID-19, but comorbidities and these fake concepts of herd immunity. You also had attempts to discredit masks. And we're seeing now in the parts where we have the worst levels of COVID-19 are people who bought into that whole disinformation campaign. So the latest piece to all of this is I'm so worried that the numbers are accelerating beyond any level of meaningful control. So that the new estimates from the Institute for Health Metrics and Evaluation are that by the week or two after the inauguration, we'll have lost the lives of 400,000 Americans, the same number of American GIs who lost their life in World War II. That's how catastrophic this is, including 150,000 Americans projected to lose their lives between now and a week or two after the inauguration, lives that don't have to be lost. And so the message that I've been pushing hard on is to anyone who will listen is nobody has to lose their life, right? We know how to keep people safe and especially to prevent those surges on the intensive care units where the mortality rates really go up as nurses and other health professionals become exhausted. That's what we saw in New York and in March and April. It's what we saw in Southern Europe and Spain and Italy in March and April. The mortality rate went like this and really climbed. This is what we're seeing now in the upper Midwest and West Texas. And the point is we've got now vaccines coming out the other end, so that if we could just keep people alive for the next 3 months, we're not asking people to do this in perpetuity, right? The aggressive social distancing, preventing the surges. Hang on 3 months and we're going to start vaccinating. All of these vaccines that you're hearing about, whether it's the 2 mRNA vaccines from Pfizer and Moderna, the adenovirus-based vaccines from AstraZeneca, Oxford, and J&J. We have a recombinant protein vaccine that we're now accelerating in India in collaboration with BioE, one of the big pharmaceutical producers in India. They're now making 1 billion doses of our vaccine tested across India. That's exciting. We've never made 1 billion of anything before. All work by the same principle. They all work by inducing immune responses to the spike protein of the virus, which by now everybody's seen a cartoon of the spike of the coronavirus with the spikes emanating around it. It's what binds to our host tissues. If you can induce high levels of virus neutralizing antibody together with some T cell responses, you'll get a vaccine. And it turns out there are multiple ways to do this, and everyone seems to work. Our recombinant protein does it that way. The mRNA vaccines do it. The adenovirus-based vaccines do it, and the others to follow. So we are going to have a fleet of vaccines, around 6 or 7 vaccines that will come out of the US Operation Warp Speed program. There's also a global ecosystem that includes our vaccines and a Chinese inactivated virus vaccine and even a Russian vaccine, which is an adenovirus-based vaccine. They're all working pretty much by the same way. And so I think what the interesting thing about 2021 is going to be this rolling out of all of these vaccines, getting the American population vaccinated and the global population vaccinated. One of the sticking points is going to be how we ensure equitable access of these vaccines, because we're trying to avoid a 2-tier system where you only have the mRNA and adenovirus-based vaccines in the US and Europe and Japan, and then the traditional technologies in low and middle income countries. And it's great that we can help contribute to a vaccine of that type, but we don't really know which is going to be the best and which is the most durable for protection. And one of the questions I get asked a lot is, hey, Dr. Hotez, which vaccine are you going to wait for? And the answer is, I'm not waiting. I don't want to go through the next few months without virus neutralizing antibodies in my system, which is the best way to keep me and my family out of the ICU. And so any vaccine that comes along that's authorized by the US Food and Drug Administration, I will take. And even if it turns out that because we don't know what the durability of protection is, even if it's not that long, so what? It'll have saved our lives, and then we can always get boosted later on with one of the other vaccines. So it's really important not to overthink this. In the meantime, for me, it's all hands on deck to try to save lives in the heartland and in Texas right now. And, one of the things that we're always told as scientists is we shouldn't politicize, we can't, buy into the politics. We have to keep the politics separate from science. One of the things that I've noticed in my um, eh, being on the cable news networks and things like this is, it's not the scientists didn't tie it to the politics. The politicians did, and they kind of forced us in this funny position where you have to get your hands dirty with politics in order to really go through the science. So, what I saw starting in around May was, I think the White House was making a good faith effort to, use science-based approaches. And then they made this pivot. I think there was a decision that they had to deny the extent of the epidemic in order to save their campaign, their election campaign, which was a disastrous decision for them as well. And that's when you started to see the disinformation come and all the things we've been talking about, trying to say COVID-19 is a hoax and all of those kinds of things. And here I was, I didn't know how to call it out without getting into the politics of it. So, this idea that it's okay as a scientist for you to speak in public, but just stick to the science, just stick to the science. It actually got to a point, and my wife Ann saw this. She said, I see this is tearing you apart. You need to call it out, and I have been since the summer, really explaining why this wasn't just this was a deliberate anti-science disinformation campaign. And being the OG villain and an expert on this, I could smell a disinformation campaign from a mile away, and I knew what this was. And that put me, and that's been tough ever since, being in this odd position, throwing stones, being the scientist, explaining the science, but having, by necessity, to throw stones at the White House. That was a very tough position to be in. And then getting attacked by all the Russian bots and trolls, and it is a crazy universe. On the one hand, it's very exciting for me personally to use my MD and PhD and to use science for public good, to make a difference in terms of making a vaccine and communicating to the nation. On the other hand, the intensity of everything right now has just been unrelenting. And this whole year, since May of the, going to war with the White House Coronavirus Task Force, that's taken a big toll on me. So I still don't know where it's all gonna go. So maybe that's kind of a 30,000 foot aerial view of the world. So maybe I'll stop there and see what people are thinking and questions, etc.
Yeah, thank you so much. I absolutely appreciate the work that you're doing. You have been extremely visible across the media, making efforts to appear on all of the media outlets, as opposed to just a few, or the chosen few.
Well, I was going on Fox News, CNN, MSNBC every day. That's not easy going
Yeah.
from MSNBC to Fox News, right?
No.
I was really proud of that. And then, when I noticed when I had to call out the disinformation, my requests on Fox went way down, and then they kind of disappeared for a while. But they just had me back last weekend. So I'm hoping that's
interesting.
fine, because we have to reach, the people in the heartland and West Texas. I mean, I really feel it's important to try to save as many lives as I can. And so I'm now deliberately seeking out to speak on conservative news outlets. I spoke to the Daily Caller last week, and the DC Examiner, and I'll talk to anybody if it can make a difference to diffuse the disinformation.
Yeah. As far as politicizing the science, there is a dwell point in the middle where, so we had the CDC that used to be trusted for a scientific outlet became politicized, and now the public and misinformation, disinformation campaigns are purposefully misinterpreting the messages of the CDC to support their own messages. Do you have any thoughts or advice on the difference between, say, initially the CDC said, don't wear masks because they were trying to save N95s for the healthcare frontline workers, and now the message is wear masks. Yet there's a massive debate, and people continue to use information from the CDC from May to support their anti-mask
Yeah,
messages.
that's what anti-science disinformation movements do, and this is what the
Right.
anti-vaccine movement is doing for years. They will cherry pick various facts and factoids and then string them together into a false narrative, and if you're not really savvy to it, it can be very daunting to go up against it. And that's what I kind of see happening a bit with the Great Barrington Initiative, supported by the Koch family, the Koch brothers. Well, I guess it's just one Koch. But this is really tough to go up against it, and it takes some skill to debunk it. I think what happened with the CDC is still a bit of a mystery. I mean,
Yeah.
for two levels. One, White House interference with health and human services agencies is nothing new. They all try to do it. Every administration tries to mess with the NIH, the FDA, and the CDC. It just happens. It's just that historically, the agencies have been able to put enough of a ring fence around them to block any serious incursions. And I think that happened, still is the case with NIH. NIH has still been able to, keep the White House out. And I think part of it is because people like Francis Collins and Tony Fauci have been there. And it's not just Tony and Francis. If you look at the next level down, some of those people have been there since I was an MD PhD student, right? So that I think what happens is when the White House, says do X, Y, and Z, they just look up and say, oh, Jedi mind games, and sort of, close back down and ignore it. And so I withstood that pretty well. FDA had a rough start this year, but I think they've really rebounded nicely. I think, I'm really crediting Stephen Hahn, Peter Marks, people like that, really holding the line really well in the science and doing good quality regulatory science. I think, in some ways that they're actually heroic in some of the things they've been doing. CDC seemed to cave pretty early to the White House incursions. And then the question is, was it all White House incursions, or was there something else going on? Because there were other problems. There are things like, why did the CDC miss the entry of the virus from Europe, right, causing that horrible epidemic in New York City, or the debacle with the testing, and then the schools. I think one of the unknowns is how much was internal collapse versus White House incursions, or whether there was some weakness in the infrastructure there that allowed the White House to exploit it. I don't really have a sense of that. One of the things I do feel, though, and I have an article that's out today, and I wanted as many people to read it as possible, so I put it in Microbes and Infection. It's out today, and David Achias very kindly is making it open access for a while. It's on my Twitter feed. Is
Great.
What the new Biden team needs to think about when they take office, and the paper is actually called Wednesday, January 20th, 2021, which is the day of the inauguration. One of my recommendations is this whole concept of task force didn't work, right? It clearly was a failure. And for the White House coronavirus task force, I think we got to take the control of this epidemic out of Washington and actually put it in the hands of the CDC, right that ship, fix whatever needs to be fixed, and have the whole epidemic response run out of the CDC, led by the CDC director. We'll see how people respond to that, but because I think right now the American people just don't trust anything called the White House coronavirus task force. It's been too contaminated.
Yeah.
And running out of Atlanta, take it the hell out of Washington now.
Yeah, there are a couple of questions from our Q&A, a couple that are kind of in line with each other and this topic related to, anonymous attendee in both of these questions asks, could you talk about what the situation might have been like in the US if we had nationally organized a set of responses from early March? And then additionally, there are other countries that seem to be doing better. For example, Australia, New Zealand. I live in a state that has had reasonable and some say draconian control measures put in place since March, and yet the four states that surround us are now the worst in the country for per capita infection rates. It seems that no matter what the governor does in my state, we cannot control for the infections coming through the borders. So, on both those questions, can you comment on kind of the national control top down versus state by state
Yeah,
independent bottom
I mean,
up control?
I think with our response, we never had a national program. It was always put the states have to be in the lead, and the federal government will provide backup support for FEMA and supply chain management and PPE and gowns and ventilators. And it sounded okay, but it failed miserably. And I
Mm.
think a few things about that. I think first of all, to actually control COVID-19 required a lot of sophistication in terms of epidemiologic models. And in following epidemiologic models, the states did not know how to do that. They didn't really know how to do it. They really needed to be directed, not sort of left on their own to figure out with some backup advice if they wanted it. That didn't work. I think the other reason was, especially in my part of the country, or in the middle, where the political forces are pretty strong around resisting all the health freedom, medical freedom garbage. I think the governors needed the cover of the CDC to say to their constituents, look, I hear what you're saying. I know why you're not happy, but the CDC is telling me if I don't do X, Y, and Z, this many Floridians will lose their lives, or people in Georgia, or Texans, or Arizonans, or Californians. And that conversation, I think, never took place because the governors were left to kind of figure it out, and it just had disastrous consequences. I think had we had a White House that was willing to let the CDC run things, and assuming they'd worked out some of the internal issues, I think we would have been in a much better position. And if we had an advocate in the White House that didn't attempt to discredit control measures and didn't buy into all the fake herd immunity stuff, so that what happens now in the middle of the country is people tie their political allegiance to not doing things, to not wearing masks, resisting contact tracing. I mean, we heard this horrible story that came out in Slate and elsewhere this week of nurses reporting taking care of patients in the ICU, and at their dying breath was the dying statement was that COVID-19 is a hoax. So they're not even dying with dignity, right? It's just so heartbreaking, and we never should have been in that position. It clearly shows that this polarization in the country between extreme left and extreme right is not working. We clearly need pragmatic, non-ideological leadership to get our way through this. And if you look at the countries that have been successful, right? New Zealand, you mentioned a couple of others, that's what they had. They didn't have all the nuttiness and the ideologies. It was just simple, hey, we've got to save lives, pragmatic leadership, and this is what we're going to do. And that's generally worked. And even now you have the Texas governor with this horrible situation in West Texas saying we're not not doing any lockdowns. No scientist uses the term lockdown, right? Lockdown was something they did in Wuhan, in very draconian measures. Nobody ever said that. But again, this is what they did. They create these straw men, these sort of fake targets that are totally unnecessary. And it's resulting in massive loss of life. And I've got to do all we can. And I'm trying to, but the problem is, who am I? I'm a medical school professor that has been fortunate enough to have access to CNN and MSNBC and BBC and things like this, but it's not adequate. It's part of the problem is I am a medical school professor. I don't have accountability in the government, right? I mean,
Right.
I say what I think, and try to. One of the things I do in my science communication is I try to provide the underlying assumptions for what I'm saying, and I think that helps people a lot because, too often we hear these pronouncements. And this is what we heard from the White House Coronavirus Task Force. You're like, where did that come from? And at least what I try to do, if I'm given the time, is to say, well, this has happened and this has happened and this has happened, and therefore I think this. And that's really useful because sometimes I get it wrong. And then
Mhm.
when people call me out on that, I said, yeah, that's true. I did say that. But I said that's because X, Y, and Z, and then Y changed. And people get that. And the other thing I find in my science communication is that, some schools of communication, I think in the 1980s, they told all science journalists that they have to talk to the American people like they're in the fourth grade level or sixth grade level. And it's
Yeah.
true. I mean, I find you can talk at a pretty sophisticated level to general audiences if you're willing to take the time, not use too much jargon. And I think that's the problem. I think too often, and I saw this with the White House Coronavirus Task Force, they would do, that old school journalism approach, talk to you like you're in the fourth or sixth grade level. One, it was off-putting. The American people didn't like to be spoken to like they're in the fourth and sixth grade, and it didn't provide cover when the science shifted as we learned more. And so I think there is an art to science communication, and not one. There's a science to science communication, and it
Bit of
means
both.
having time is important, but I think if you're willing to explain your underlying assumptions, why you're coming to this conclusion, go into more detail about the virus, people get it, and they like it, and they feel they trust you more too. So
Yeah.
if there's any silver lining on this pandemic, I do think we are in a situation where scientists became more trusted than politicians or elected leaders, oftentimes, and that's good for our profession, of course.
Absolutely good. And along these lines, there are a few questions related to communicating about COVID-19. And one of them is related to the vaccines themselves. And Kishore Mehta asks, what happens if 25% of the population refuses to get the vaccine, to take the vaccination? And in those lines, how can we communicate vaccine safety, vaccine effectiveness, and what are the messages that scientists and doctors can use to increase vaccine acceptance?
Well, I think a few things. One, I think Operation Warp Speed worked really well in terms of the scientific rigor and the integrity of the clinical trials. One of its flaws was it had no communication strategy attached to it. The communication strategy was to have the pharma CEOs lead the communication, and most of them screwed it up. I mean, you had the AstraZeneca CEO leak on a phone call information about clinical holds or pauses due to transverse myelitis and maybe multiple sclerosis. That created a lot of uncertainty. You had the Moderna CEO on board, all those stock transactions and conflicts of interest. And even the Pfizer CEO made some missteps. So I think that was a flawed strategy. I mean, there should still be somebody out there communicating on a regular basis with the American people, almost like Andrew Cuomo did during March and April in New York. Doesn't
Mhm.
every day maybe, but on a pretty regular basis. So there's a small cadre of scientists the American people get to know and trust. I think that would have helped a lot. I think then you're right. We have those surveys from Reuters and Associated Press saying a significant percentage of the U.S. population will refuse COVID-19 vaccines even if they're made available. I think it'll get better at once we see people getting vaccinated and nothing bad happens. I think people will start to get it, and I think it'll get better than we think. But I've been on a number of Zoom calls with various government agencies and in the scientific community. And there's been a heavy emphasis, and I'm co-heading with Saad Omer, a Lancet Commission for vaccine hesitancy in the US, and we're taking on COVID-19 vaccines first. A lot of the discussion is around the messaging, how we amplify the message, how we fine tune the message, how we tailor it to specific groups that are refusing COVID-19 vaccines, especially the African-American community. And I think all those discussions are great, but then I offer a personal opinion, which kind of deflates things. I say, this is wonderful, you're doing this. This will get you about 30 to 40% of the way there. And I say that because, and this is my opinion, I'm actually an outlier here. Most of the vaccine advocacy community is actually in disagreement with me. So just for full in addition to this OG villain, this is also like disclosure that I'm a bit of an outlier or sort of alone on this. I also say it's going to take you 30, 40% of the way there. Why? Because all your messages that you're fine tuning and shaping, they're messages in a bottle in the Atlantic Ocean, because the anti-vaccine, anti-science groups dominate the internet. I mean, 438 fake anti-vaccine websites, all revved up on social media, Facebook. The Amazon site, if you go to Amazon.com and you put books up in the search engine, you couldn't even do this now. You press books up in the research, press return. You get a scroll down menu at the left. You go to health, fitness, and dieting. You click on that. You'll get another scroll down menu that lets you choose vaccinations. You click on that and watch the horror unfold. It's all crap. It's all fake anti-COVID-19, anti-vaccine books, anti-COVID-19 conspiracy theories. So Amazon is the single largest promoter of fake anti-vaccine, anti-science books. They are one of the major contributors to the anti-science movement. And the part of the problem is when I start doing this, if you let me go on long enough, what have I already talked about? I've talked about the far-right extremism. I've talked about neo-Nazi groups in Germany, QAnon, the Russians weaponized health communications. Now I'm talking about Amazon.
Health freedom,
myself, and I realize I sound like somebody who throws things at the TV. I mean, I sound like this
maybe
person.
You do.
But it's real, and so, but you have to, I mean, it's so out there and so outrageous that we have to find a better way to do this. And so the bottom line is, until we dismantle the empire, the Confederacy, this stuff is going to continue. And so how do you do that? And I've proposed, and I put it out in that paper today in Microbes and Infection, we need an interagency task force, and not just health and human services agencies. We need the Justice Department, Department of Commerce, we need Department of Homeland Security to really look at this and show how dangerous this is. This has become basically the COVID-19 shifted from a public health crisis to an economic crisis to a homeland security crisis. Things have never been more destabilized among the American people, and it's happening internationally as well. So our anti-vaccine, anti-science movement, extremism, has globalized now to Western European capitals and possibly elsewhere. So the United Nations agencies are looking. There is even a new term, they call it the infodemic, starting to look at this as well.
The infodemic. I came across an idea recently that as human culture evolves, that what we haven't evolved yet is an immune system for within our culture, that we have a physiological immune system for our body, but we don't have an immune system for information. And so misinformation can spread rapidly. So maybe there are governmental regulations, maybe there are corporate and communications institution regulations and self-management that can help manage some of this information spread.
And also, I think this needs to be taught in graduate science education, or maybe even undergraduate science education. We have to know what you're up against, and and part of the problem is universities. Office of Communications. Ours is pretty good, but a lot of University Office of Communications they're very traditional. They tend to be pretty risk averse, and they're all about protecting the reputation of the institution. So they don't often like their scientists speaking to the public, right? Because they can't control that. And I think one of the things you have to remember is your agenda is not their agenda. They're about
Right.
protecting the reputation of the institution. As scientists, you're out there fighting for social justice and dismantling the anti-science movement. That's not their priority. And so there's going to be a natural tension to that. And so how you navigate that with your Office of Science Communications is a bit of an art. I think the other problem that I'm seeing now is, if in terms of my career, no one knows what to do with all this stuff that I'm doing about the books and the op-eds and the CNN and MSNBC. When I get evaluated, even I get evaluated every year at my level, and I have to fill out an annual evaluation form. And what do they want to know? They want to know about my grants and my papers, my scientific papers. And they want to know about my grants and my scientific papers. Also my grants and my scientific papers. And my grants and my scientific papers.
Scientific.
And nowhere on that form, my annual evaluation form, is anything about the books I've written, single author books I've written, or the op-eds, or the TV and radio appearances, and certainly nothing about social media, right? So the message is sent pretty explicitly. Dr. Hotez, we do not think any of the stuff you're doing is important. You want to do it, even though it's, in some ways it's saving lives, and, it's promoting science. It's not valued by most universities. And now that I'm a dean, I've joined the dark side. So we've got to figure out a way to educate our deans and our department chairs that this stuff's important. And
if there are institutional changes,
right. And so for things like promotion or tenure, whatever you do at your university, that doing this is not just an annoyance, that what you're doing is actually valued and important and making a contribution. That's as much as your scientific papers and grants. And we're just a long way away from that so far.
And thinking about the vaccine and hesitancy versus acceptance and messaging, Michael Swift asks about celebrities. Would it help if high-profile athletes became vaccinated and publicized their participation once a vaccine is available? And then someone else is wondering if you know how the vaccine is going to be distributed once they are available.
Yeah, I think having high profile people get vaccinated certainly helps. I mean, good to have LeBron out there getting vaccinated, and James Harden and people like that. I don't know how critical it is. It certainly wouldn't hurt. What does hurt, though, I will tell you, is a lot of celebrities or high profile people who trash vaccines or question that is certainly very.
And that has a long history.
No, the anti-vaccine movement is very well tied to high-profile individuals, and it's caused a lot of damage. It continues to cause a lot of damage. I think the other thing we're seeing is now the targeting of scientists by the anti-science movements, right? It's me and Tony, Dr. Fauci and Bill Gates, and that's also creating a lot of damage. In terms of how vaccines will roll out, it's going to be very much controlled at the state and local level. I mean, the guidelines seem to be healthcare providers first, and first-line responders, and then older populations. But exactly how it's going to roll out, I mean, hopefully, in the first few weeks there will be limited supply, but I hope we can build up rapidly. And as at least 4 or 5 vaccines come online, hopefully that will take care of it. And in terms of distribution, many of the vaccines can be refrigerated. So even the Moderna mRNA vaccine, you can keep it for a month at 4 degrees, according to the press release. So we'll see if the FDA confirms that stability data in refrigerated temperatures.
Doesn't have to be minus 80.
Well, the problem was the Pfizer one, right? The Pfizer one is minus 94 to 100 degrees Fahrenheit. It can stay at 24 hours at 4 degrees, but it's not very long. So that one may need a specialty system to vaccinate. It's going to be more problematic. Most adults now get their vaccines in pharmacies, especially in supermarket pharmacies and that kind of, or Walgreens or CVS. It's going to be harder to do it for that one, but the others, I think you can. So there's been some discussion about maybe because of that extra complexity for the Pfizer vaccine, we'll do that one in urban areas where it's closer to the freezers, whereas Moderna vaccine can be more easily distributed in rural areas. And
Yeah.
we'll see how all that goes. I think one of the things trying to get people to aware of, the age cutoff is 65. When you talk about older populations as the next rung, but if you look at the data from the CDC, 30 to 35% of African Americans and Hispanics who die and Native Americans who die from COVID-19 are under the age of 65. So their mothers, fathers in their 40s and 50s. So I think that 65 cutoff might be too stringent and not really considering the high death rate among younger age groups for Hispanic, African American, minority groups.
Yeah, maybe there are other risk factors that should be taken into consideration as opposed to just age. Yeah.
And hopefully this, as vaccines become available, this all becomes a bit moot. We can all get vaccinated.
Yeah, and then maybe we'll be getting it every year. Maybe it'll last longer. That's still up for debate.
We don't know about the durability of protection, right? Because brand new technologies. But again, I think, you can get boosted and with, maybe our vaccine will come in later on in the US as a boost. That would be kind of interesting also.
Yeah. Are you worried about about mutations affecting the efficacy of the current vaccines in development?
Well, certainly RNA viruses mutate. I haven't seen a lot of evidence suggesting that the mutations are accumulating to the point like they do for flu where the vaccines won't work. It may get there eventually, but I think for now that's not the top priority concern. Although we are now trying to put together a program for making a universal coronavirus vaccine.
Amazing.
The reason is, we've been working on coronavirus vaccines for the last decade.
Right. And the next pandemic might be another coronavirus.
Well, look, we had SARS in 2003. We had
MERS.
2012. We have COVID-19. Yeah. Now, COVID-26 is coming and COVID-29 and COVID-34. So we need to have that. So we're trying to put that together. And what would that look like? And either as a protein-based vaccine or as an RNA vaccine. I think now with all the initial success of the RNA vaccines, I think that's probably going to be a game changer now in terms of the whole field.
That would be, it sounds like that would be amazing. Still working on a universal flu vaccine. These vaccines are not easy. We've got Operation Warp Speed that has maximized the resources put towards this SARS-CoV-2 vaccine effort. But will these kinds of resources, will it be continued into the future for something like a universal vaccine? Or are we going to end up with the original SARS vaccines that got left on a lab bench?
Right. Or in our case, our freezer.
Our freezer, right. Funding runs out and So this is the kind of thing also that could it potentially be a good messaging effort for scientists and knowledgeable people to help move policy moving forward to continue these effords after this pandemic is taken care of.
Also, this is why we need subject matter experts in so many areas, right? When COVID-19 hit, there weren't a lot of coronavirus people to talk to in this country. Even our group, I'm not a virologist. I devoted my whole life to parasitic diseases, making vaccines for infected tropical disease, parasitic diseases. But what happened was about a decade ago, we got linked up with a group at the New York Blood Center led by Shibu Jiang and Lan Yingdu. And the person who introduced us was a colleague who worked on river blindness, onchocerciasis. Sarah Lustigman introduced us to that group. And basically the coronavirus vaccines were orphaned. So we kind of adopted it because nobody else was touching it. And it was kind of cool to go into a new area in virology. We'd never done virology before. and everything went really well. We made a pretty good SARS-1 vaccine, MERS vaccine, and so we were able to hit the ground running on COVID-19.
Yeah. Experience helps. A few people are wondering, based on your book also, how do we best prepare for the next big one? Is it going to be science communication? Is it going to be actual institutional preparation?
Well, with each pandemic, we get a little better. So after SARS-1, we put in IHR 2005, International Health Regulations. That was an important step. Then with H1N1, the Obama administration put in GHSA, the Global Health Security Agenda. That helped. And then CEPI was created after Ebola, Coalition for Epidemic Preparedness Innovation. So we sort of move towards that preparedness a little better each time. I think this one is such a game changer that we're going to be more open to out of the box things than we were in the past. In the book, I end by saying, we're too focused on the G7 nations and comparing wealthy countries to poor countries. And I see a greater role for the G20 economies for two reasons. One, the G20 countries account for 86 to 90% of the global economy. But second, in a book I wrote called Blue Marble Health, we found it's the poor living among the wealthy in the G20 that actually come from most of the world's poverty-related diseases like leprosy and leishmaniasis and Chagas disease and worm infections and dengue and tuberculosis. And that's also true of COVID-19. So I think I see a greater role for the G20 in this. And that's not been easy because the big contributors are always the US government, the UK government, that country called the Bill and Melinda Gates Foundation, and then the others often fall off pretty dramatically. Japan's starting to step up a little bit in those, but China underperforms in terms of contributing to that, and so there's Russia and other countries, and I think I would like to see greater G20 involvement.
Great. In the last minute or so here, can you comment on the upcoming Thanksgiving holiday and how people in the audience, scientists, can best communicate with their families about how to best spend this holiday and the other upcoming winter holidays?
Yeah, I think the message is this is going to be a crummy winter, and it's November, December, January. We have to maximize social distancing. So, and it's only for a few more months, so we can have future Thanksgivings and Christmases to come. So, for instance, my oldest daughter, Emmy, who's a doctoral level research scientist at UCLA, was going to drive with her husband from Los Angeles to Houston, and that meant stopping in New Mexico and El Paso or somewhere around there.
Mm-hmm.
Because you couldn't make it all in one day. And I, was looking at the COVID numbers and I said, Emmy, you can't come. You just, you'll get COVID or you'll give us COVID. And, that was a tough conversation. I mean, it's not the end of the world, right? But it's sad. I mean, so there is a lot of, now we're kind of struggling with my other youngest son who works in the petroleum engineering, what to do about that as well. So,
yeah, difficult conversations for everyone, but I think your message is right on, that if we want to have future holidays together, for future celebrations together, healthy
just
and
hang on. I mean,
sooner.
Pretty soon everyone will be vaccinated and everyone will live a normal lifespan. And won't die from COVID-19, but that's the tough message to get across right now.
Yeah. Long-term gains over short-term gains. Let's think for the future.
Right.
Thank you so much for your openness today and your work in science communication. I'm sure people will be looking for your book, which is coming out March 2021?
No, next month.
I thought it was coming out later. Fantastic. Next month. Great.
It's called Preventing the Next Pandemic, Vaccine Diplomacy in an Age of Anti-Science, Johns Hopkins University Press.
Wonderful. And people can follow you on Twitter.
And you can get it on Amazon. All the anti-vaxxer
Amazon,
books.
right next to them. That'll be fantastic.
Yeah.
Thank you so much for your time today. Thank you, everyone, for your time and your attention and your many questions. And I hope that you all have healthy and safe holidays moving forward. Thank you for visiting another Sigma Xi Distinguished Speakers series session on COVID-19.